It is becoming a reality to nations and decision makers that healthcare delivery will not fall back to manual systems anymore. The emergence of a new wave of healthcare innovations based on digital technology has raised great hopes and expectations across the transformation of healthcare systems to offer more effective, efficient, and personalized services in today's digital era. In this edition of Tech Live with Ugo, we had a beautiful chat with the co-founder and chairman of Cranium Integrated Solutions Limited, Engineer Kunle Adesida. Cranium Integrated Solutions is a local content digital health app designed to address the challenges of health management in Nigeria and Africa. Join us on this interesting session. You are warmly welcome to our program today.
Thank you very much.
How has it been with you?
We thank God.
So when we're talking about the economy, how have you been managing this economy?
Well, do we have a choice? We have to get used to it and tag along.
Sure.
Yes.
Lord will continue to lead us.
Amen. Amen. That's our prayer.
Exactly. So talking about Cranium Integrated Limited, tell us what that name, Cranium.
Cranium is actually a tag for an app.
Okay.
The full name is actually Cranium Integrated Solutions Limited, which is the company.
Okay.
And then Cranium is an app. We call it a Cranium Complete Health Information Management System. We decided to tag the two along so that it can be a uniform name.
Okay.
Because we actually have a patent right in that name, which is an exclusive right. So we want to ensure that we keep that name and we don't allow anybody come around it.
Oh wow, that's a good one. Okay, what informed that name, Cranium?
Okay, so many years ago we started thinking about what we could use to actually identify a brain of an entity. So cranium is actually like the skeletal of the skull. So when we talk of health information management system, and we don't want to say we are looking for the heart now. We are trying to look for the brain, and that is where Cranium came to life.
How long has the product existed?
We've been in this field for about 2 decades plus 3 years.
Oh, wow.
To be precise, and the product has existed for about 20 years also. It took a long time before people started hearing about it because it's a local content. We had to bring in a lot of professionals in both medical administration and many fields that work within the hospital environment. Because we needed to cover both the clinical aspect, the administrative aspect, the financial aspect of the entity, the whole health care delivery.
Talking about all of this and having been in existence in the last 2 decades, have you been able to achieve your mission, or should I say your vision, for Cranium?
We are still in it.
Okay.
We can say that we are moving towards it now. You see, because adoption rates of anything in Nigeria is usually very slow. And because COVID-19 came about, and then it's propelled many people to begin to look in the direction of digital health.
Yes.
So between that time and now, there has been so much transformation in the healthcare industry, such that many are now looking in the direction of digital health. Why? Many don't want to go to the hospital. So many people are running, I don't want to go to the hospital, running away from going to the hospital and bringing something else back home.
Yeah.
So now you can sit in the comfort of your homes and then you can access care via remote patient monitoring. So everybody is looking at the avenue whereby you can have care without having to add some other things that are not supposed to be necessary.
Well done, I must say. Okay, there's this question that is I see it as critical, but I don't know if it is same with you, because many people obviously are complaining about treatment, especially in hospitals, as not very effective. Obviously, they get to run out of the country so that they can be well attended to. How will Cranium help ensure that doctors are actually doing the right thing? But before you respond to this question, please permit us to go on a short break and we'll be right back. As earlier said, I am Ugochi Emmanuel, and we have with us our engineer Kunle Adesida, the co-founder and the board chairman of Cranium Integrated Solutions Limited. I asked a question before we went on that short break, and I said many people get to leave the country all because of low treatment attended, they're not being well attended to in Nigeria. How is Cranium helping to ensure that doctors are at least doing the right thing?
You see, we can look at it from two angles.
Okay.
The first angle is we have people who don't believe in our healthcare delivery system in Nigeria.
Yes, and that's because people get to feel that we do not have the right equipment and expertise.
Exactly.
Yes.
So for such category, the first thing that comes to their mind when they need care is,
Okay.
oh, let me run to India, let me go to the UK, let me go to US and Canada and all that. But you know, the shocking thing is that many of these countries that you run to, you find a Nigerian doctor there that will still attend to them. Now, for the other scenario, you find patients who may not be able to afford to go outside the country, but they still want to access quality care. They get to the hospital and then they meet a medical officer, clerking them. Now, he has gotten their presenting complaint, the history, he's doing his physical examination findings, and then he wants to form his notes. The first thing that will be in his mind is, from what this person is saying, maybe we should look at malaria. That could be his first presumptive from the symptoms and the information the patient has given. And then he may want to go in the direction of checking if this person is having malaria. And then, you know, sometimes, most times, when we go to the hospital, malaria can begin to look like typhoid. Typhoid can begin to look like malaria because they have almost similar symptoms. So if you don't check well, you may not eventually know what could be wrong with the patient. But when you have a system that has clinical decision support system embedded, it will help the clinician be able to clerk well. How? When you begin to supply the symptoms that you are feeling, and then you are beginning to give details of how you're feeling those symptoms, and the doctor is taking those details down in the system itself will flag a presumptive that you should be suspecting. So now it is left for the doctor to go by the artificial intelligence that has already told you that from this explanation, it is most likely between 80 to 90% that this is what this person is actually suffering from, and this is the best possible care plan that you should follow.
Wow, that's an interesting one. We're still talking about, you made mention of the Cranium is the public and the private sector are keyed into this. Are you saying that the government has actually keyed into this solution?
Yeah, I think about 2-3 years ago, we had an interview at the Federal Ministry of Health. We had all their stakeholders in that meeting. They evaluated our products and then gave us a letter to all government hospitals. You see, because you don't just walk into any government hospital and go and deploy any health information management system. You must have gone through the Ministry of Health. It would have been checked and validated that yes, this is good for government hospitals before you move into any government hospital. So we went through that process and we were passed. We were given a letter by the Director of Hospital Services, and we went to some government hospitals. We had a pilot study, and to the glory of God, it was successful. And we started moving to other government hospitals now. We have many private hospitals already running. You know, they can just take decision one time once we see the medical directors. You see, but the adoption rate is still very slow because many people in government hospitals, once you come in, the first thing that comes into their head is, they have brought a technology that will come and sweep us off our job. But unknown to them, it has come to enhance what they do. So what we need is for government to put policies in place.
How can the government come in to ensure that this app, this thing is being used and extremely, or should I say, embraced by all and sundry?
Addressing what you said,
Okay.
government now needs to enforce the usage. If you are able to comfortably deploy, the next thing to do is to enforce. I want to commend Dr. Liasu Adeagbo, is the CMD of Federal Medical Center.
Oh.
We deployed in FMC Owo successfully because he was on his toes. Weekends he will come in and look at who is trying to perpetrate or bypass the application, and he put his foot down that whoever does not use this application well will lose his or her job. That is a level of enforcement. We were always there on Saturdays and Sundays. In the middle of the night we were there. That is why we were successful in FMC Owo. So no matter where you deploy, if the chief executive or the stakeholders at different levels are not in tune with what you have put in place and they don't enforce it, it can never be a success.
Well, I will still allow us to go on a short break, and then we'll come back again to finish before we draw this curtain. Thank you for having us here today, Engineer. You have really done us a great one, because a lot of us are here, we don't understand all of this. But I'm sure people out there who are listening to us will learn from you today. But before I ask you this question, you're an engineer. What informed is your idea of this app, especially having to do with the health sector?
Okay, there is one history behind the scene.
Okay.
It came via a project that I did when I was in the university. I was supposed to develop a small application for health information managers.
Okay.
And I'm happy you are even asking this question so that I can actually use it to appreciate Dr. Moji Ario. She's in Emory University in US, and she's actually one of our shareholders too. She always told me that this small thing you have can become very big. Let us push this thing and see how we can impute other departments and turn it to a big deal. And that was how we started. Dr. Mojario was actually with Ben Carson College of Medicine as at that time. She was in Nigeria, so we worked on this together. She's an internal medicine consultant, and I'm sure she has been in the field for over 30 years. She's one of the best in the US now. We went through all the process together, and then we started linking it at every patient contact point. Okay, from medical records, where are we supposed to link to? Then we link it to the next one, we link to the next one, and that is how we were able to link the complete patient flow process that any hospital in Africa can buy into. Because it is a local content, and we took into cognizance how the flow of our hospitals are in Nigeria and in Africa. We have some hospitals even in Africa running cranium as we speak now, because it is seamless and it is customizable. So the way you run your flow, you see, a fee for service patients, there is a flow for them. Insurance patient, there is another flow. NHIS patient, there are different flow for different category of patients in any hospital. So we're able to put all those flows together, and then we made it worldwide acceptable, and then we locked down on all the policies that we needed to go through, and then we set it rolling. We piloted it with a private hospital in Ibadan, and I don't want to mention the name. Many years ago, it worked perfectly well,
and it's still working.
It's still working till now.
What is the unique point, or should I say the unique selling point of this very app?
Our unique selling point is that our product is local content. We
And
deploy
it's
to you.
residents,
You own your data. As any hospital or facility, Once we deploy for you, we deploy on a web server that will sit in-house within your facility. We back it up with cloud server that is your backup for your facility that you have administrative rights and privilege over. So you own your health data. We don't do subscriptions. Once we deploy for you, it becomes yours. It's a single license that you can use forever.
Okay, so how affordable is this app both to the government and of course to private health centers?
Yes, it's very affordable. We have different prices for different category of hospitals and facilities.
Okay.
Depending on how large you are. We don't limit to users. Once we deploy enterprise version to a facility, you have unlimited users and unlimited access. If we deploy for private hospitals, what we charge them is different from what we charge government hospitals. And then there are some other health centers that are not up to even some level of private hospitals. The price we also give to them is also different. Because we own the product, we can decide the price to give to anybody. And we don't drive anybody away. We ensure that we have as many clients as possible, and we also allow them to do instrumental payments. So we have flexible payment plans for every category of facilities.
Wow, that means individuals like us now cannot have it. We just have to.
No, why not? We can't have it. We have.
Can individuals like us?
Oh, why not? We
have it in our homes.
We have pharmacies. We have labs.
Okay.
We have all those entities standing alone without necessarily being a full hospital.
Okay.
Our software can also be broken into modules that we can deploy for pharmacy to manage their stock. We can deploy for lab to manage their tests, generate their reports, print out reports, and then we also have artificial intelligence in it that once a test is being done, all the sequence and parameters are being displayed directly by the application. All you need to do is just put in the values. It has all the normal ranges, and then if anything is outside the normal range, it flags it. So anybody can afford it.
Let me ask you this final question. Is this app compliant with regulatory authorities within, and does it actually follow the clinical standards?
Oh yes, I said it earlier on that we follow regulations. We are NDPR compliant, and then we're also HIPAA compliant. We also have, it is also health level 7 powered, which allows seamless integration in between apps. So if you bring us in and you already have some applications running, we have a universal API that will talk to your application, and then you'll be able to synchronize data real time.
Digital health apps such as Cranium has made it possible for all healthcare facilities, both private and government, to transit smoothly. Such an initiative would help to give medical attention to patients, especially during emergencies. This is where we draw the curtain on today's edition on Tech Level to Go. Don't forget to subscribe, like, and share our YouTube channel on Tech Level to Go. Also, follow us on our social media handles as it is written on the screen. I remain your regular host, Ugochi Emmanuel. Bye for now.